Hi everyone, let's give people another minute and then we'll kick off. Thanks to those who've already joined. We are now recording. Okay, I think we can kick off and others will join as they can. But welcome everyone to Global Health Co-Financing of National Medical Oxygen Systems. So this is the fifth in a series of high-stakes conversations about the role of medical oxygen in the achievement of national and global health goals. I'm Leith Greenslade, coordinator of Every Breath Counts, and delighted to be co-hosting this conversation with Path, who have been such central players in increasing access to medical oxygen before, during, and after the pandemic. We're hosting this webinar in a funding crisis. So global health budgets are shrinking, government health budgets are tight, and the needs are only rising. But it's not all doom and gloom. Today, you're going to hear from 5 organisations where funding for medical oxygen is in scope. Most of their names will be very familiar to those who work in global health, and the others, well, you should know their names. First, we'll hear from the Global Fund, which has played such a major role. Honestly, I don't know what we would have done without the Global Fund during the pandemic, financing oxygen during COVID, and they continue to offer that to eligible countries. Then we'll hear from the Global Financing Facility for Women's, Children's and Adolescents Health, or the GFF as we call it. Oxygen is so important for maternal, newborn and child health, and the GFF does offer an opportunity for countries who prioritise it. We're going to hear from the World Bank, which is ever more important. In fact, all the multilateral development banks are becoming an increasingly important source of health financing for eligible countries. And the Pandemic Fund can't be with us today, but as they have an open call for proposals, I'm going to share some insights into how you can work with the Pandemic Fund to unlock oxygen. And then we have something really interesting, a new kid on the block. That's the Transform Health Fund, which is managed by Africa Invest. They invested in an oxygen business in Africa, which is getting a lot of attention. And we want them to talk about how they, as a private fund, are viewing investments in oxygen. And we'll wrap up with something really special. Path today is launching a series of briefs targeted at the 4 main sources of funding that we'll share today, the Global Fund, multilateral development banks, the GFF and the Pandemic Fund. And these briefs are designed to help you navigate and support ministries of health to navigate how to unlock financing from these really important sources. So our purpose today is to arm you with the information you need to help ministries of health and other national stakeholders access these funds. Remember, the title of this webinar is Co-Financing. Gone are the days when global health organisations will fully finance really anything. Governments are expected to put money on the table, and you'll hear a lot about that today. But these are important sources of supplementary finance to make the system work. We've allowed plenty of time for your questions. And as usual, please, we love comments in the chat throughout. So at React, we like you to react to what you're hearing, and we like to have a very lively chat. We ask you to stay muted and no video unless you're speaking. So we don't need to rush with this call. We have plenty of time. These are complicated issues and complicated processes, and we want to leave you with information you can take action on. So delighted to introduce our first speaker. It's Dr. Nick Furtado. I think his official title now is Senior Advisor for Medical Oxygen and Respiratory Care with the Global Fund. I have not known someone in the Global Fund who's worked as hard as Nick on oxygen in the last, it's almost 6 years now. He's a pediatric emergency medicine physician, so you'll understand immediately how close these issues are to his heart. So Nick, over to you.
Thank you, Leith. Can you hear me?
Yes.
And you can see my slides. So thank you to Every Breath Counts and Pat for putting together this very important webinar. And I'm happy and privileged to be here and show what is possible from the Global Fund side. And as you know, from the Global Fund, and as Leith mentioned, there are significant pressures on the envelopes that we have, and the current cycle, we call them grant cycles, is grant cycle 8. So I'm just going to speak very briefly. I have just very few slides to outline the opportunities and the approach in the Global Fund. And I'm open to any questions throughout the webinar. So just to step back from Oxygen as a whole and look at the Global Fund's strategic approach to the funding overall for the mission that we have in the global health architecture. As you know, and as Neet mentioned, medical oxygen was a core pillar and a strategic focus, a strategic priority for the C19R mechanism, which comes to an end in roughly 4 weeks. So to step back to what's going to continue from there is the ongoing grant cycle is GC7 and upcoming grant cycle for which we are preparing and for what we are talking about today, where the opportunities are. And the key approach for GC8 is obviously with the limited funding envelope is to maximize what for every dollar we spend and integrate for any efficiency to, because we are transitioning from a huge scale up of complex equipment during the C19RM process, the most important part for us is to ensure that equipment actually is sustained for at least a significant part of its life cycle and attains the impact that it was supposed to have. And of course, innovation is always something that is necessary as we go forward and chart the future in our mission. So within the strategic lens, obviously, what are the different approaches that we follow? You'll find that I'll mention this whole idea of prioritization. But for the Global Fund, because we are the Global Fund for HIV, TB, and malaria, the focus of the resources will be on the highest impact, most cost-effective interventions. And it will be obviously because our core business is HIV, TB, and malaria elimination. All health systems functions and investments are focused on optimizing and maximizing the impact for those diseases and more. As I mentioned before, integration is critical. So we are moving away from standalone vertical approaches as much as possible, including for the 3 diseases, and leveraging as much as possible shared platforms. And you'll see that this theme will be coming up in the next couple of slides also. And as Late mentioned, very importantly, there is a huge gap in the envelopes that we have for funding core business and health systems. And therefore, there is an opportunity for domestic financing and approaches to ensure financing sustainability and co-financing, with the idea that we are looking at a ramp off in the next 5 years or so, where a significant part of these investments would need to be funded through domestic mechanisms and models that are sustainable at the domestic level. And as I mentioned before, accelerate any proven interventions. And a lot of our partners in this in oxygen respiratory care are looking at innovations that will improve access to oxygen. So you'll see that there are 2 main tools that we have. One is called the modular framework, and here I apologize. This is a very, very small print, but the modular framework outlines all the interventions, and as was mentioned before, this is part of the DNA of our grant. So everything in the modular framework is within scope. So you'll see here in RSSH pandemic preparedness is called RSSH-PP. Oxygen and respiratory care systems include all the end-to-end oxygen supply, oxygen storage and distribution, oxygen delivery and respiratory care, that is around the patient care, uh, using all the consumables that are necessary for delivering oxygen to the patient, directly to the patients, and of course the wraparound systems support that is far more required now because of the scale up, the huge scale up in the complex equipment and infrastructure around oxygen during the pandemic, with a lagging in the system support around that. So this modular framework shows that in principle everything is in scope, and obviously that is within the lens of reduced funding for all our activities that are under the Global Fund mission. So this, though it shows everything is in scope, you'll find that the next document, which is useful for putting together grants that include oxygen, is what is called the prioritization guidance. And this slide shows, even though we have everything in scope in the modular framework, once funding requests come in, they will go through a process of prioritization, and preferably even before the funding request comes, you'll have to go through a process of prioritization to ensure that the most cost effective, the most impactful interventions are included. So what does this mean in terms of medical oxygen and respiratory care? So you see here in the first one, the first point itself reiterates some of the language that is used in the first slide, where optimization and sustainability of prior investments are critical to ensuring that what is included in the funding requests will be considered, and even considered for inclusion in the funding request in the first place. So you can see here, prioritize global fund support only if alternative funds are not available and health facilities are serving significant populations of people living with HIV, TB, and malaria. Consider any grant funding with a clear transition and sustainability plan. So, as I mentioned before, we are looking at still focusing the investments, even though it's for health systems and health system strengthening, like oxygen and respiratory care, on areas where it can impact the overall mission for the Global Fund. So when funding requests are put together, that language is critical to ensure how the thought process has gone into including those interventions within the funding requests. The second, opportunities to increase optimization and efficiency. So this is the wraparound governance, the strategic approaches that are not necessarily very expensive. They don't involve huge infrastructure, but are probably necessary to ensure the maintenance, operationalization, the integration of all those previously invested in complex equipment can be integrated and used and impactful within the current climate and with the current financing envelopes that we have. You can see here what is to be deprioritized, and obviously it's clearly very context dependent. But I can assure you from seeing the first wave of funding requests that have come in, any scale up of any complex equipment without proper plans for sustainability of the previously invested in equipment will be clearly suspect, and it will be very difficult to justify such things. So, in fact, it may be deprioritized before it even comes into the funding request, when it's being written up and the funding requests are being put together. So that it has to be very clear, even before the funding request comes, that like without prior sustaining of prior invested in equipment, it'll be very difficult to justify further scale up of equipment. So ensure sustainability and optimization of existing equipment, for more impact. And obviously, when we look at the broader wraparound, the distribution systems, the data systems around tracking and monitoring and managing oxygen systems, clearly one has to look at how existing systems, existing platforms can be expanded or used to integrate oxygen within, which could have been done, say, supply chains. Supply chains should include, the tracking, the quantification, the need, the demand, the supply, and tracking of oxygen from end to end. So those systems, existing systems that already are in place for various other commodities in the health system, should be used for oxygen, or there'll have to be a clear justification why in each context that is necessary as a standalone intervention. And lastly, obviously, other things like human resources for health, biomedical engineering, capacity building, clinical service capacity building for rational use of oxygen. All of these should be integrated into existing, say, health technology management systems or governance systems, and including ongoing continuing medical education for clinical providers. So wherever relevant, integration should be used to ensure that what we do as a one-off capacity building is not just left as it is and is not continued. There should be a plan on how this is integrated into ongoing capacity building, ongoing continuing medical education, or continuing education for biomedical engineers, health technology managers, etc. So then, of course, lastly, there's energy, as we know, it has been a huge gap as we have installed and commissioned some of these infrastructure elements for oxygen and respiratory gas. So given that any of the renewable sources of energy that can be integrated into oxygen systems, that is also a possibility to be considered. Obviously, within the context of reduced funding envelopes, we have to ensure that this is something that has a cost effectiveness, cost efficiency, and that case will have to be made. This I'll stop, and I will open to any questions on as we go forward. Thanks, Liz. Over to you.
Thanks so much. That was Dr. Nick Furtado from the Global Fund. Nick, we're going to ask you to hold. We've got a nice 20 minutes for questions at the end after we've heard from the funding agencies. So we've already got a question for you in the chat, but we'll pick those up at the end. So please do feel free to put your questions in the chat. But for those who joined late, we've had a considerable number of people who have recently joined. We are hearing from the major funding agencies where oxygen is in scope. We kicked off with Global Fund because it's such an important, it has been and will continue to be a significant player in co-financing of oxygen. And now I'm delighted to introduce someone who, if you are working hard during the pandemic, you will know this name. It's Carolyn Reynolds. And I'll never forget the Pandemic Action Network webinars and other work during COVID. And Carolyn was a co-founder of that network, and they did a lot on oxygen and they helped us a lot. So I'm delighted Carolyn's back this time with the GFF to talk to us about that really important funding stream. Carolyn, over to you.
Thanks, Leith. It's great to be with you and so many people on this call. So thanks so much for the opportunity. I'm now a senior advisor with the GFF, so I'm delighted to join this. Let me quickly share my screen. Give me a moment. Hopefully I can do this. It's been a while since I've done a Zoom share. Let's see.
You're good.
Okay, then there we go. Oh, or did I just mess that up?
We can see it. You just need to put it into present.
Yep.
Yep.
Oh, there we go. Sorry, too many screens opening.
Oh, don't worry. It's live. It's our common reality.
Slideshow. There we go. There we go. Got it?
Beautiful.
Okay, great. So anyway, thanks so much for the opportunity. I'm here on behalf of the GFF, where I'm currently senior advisor and leading on our partnerships. And again, it's great to partner with you again, Leith, and every breath counts, but also with my former colleagues at PATH. And great to their continued work on oxygen is and oxygen access for medical oxygen and pulse oximetry is so important, and happy to be part of this discussion. So I'm going to go a little higher level than the previous speaker, just because I think there's probably less familiarity among folks on this call with the GFF, and just want to make sure you're familiar with how we work. But also, I think following me will be my World Bank colleague, Nikki Chopra, who will go in a little bit deeper because, of course, the GFF and the World Bank work very closely together. So the GFF mission is ending preventable deaths of women, children, and adolescents. It's now in its 11th year, launched in 2015, really at the start of the SDG era, hosted in the World Bank Group, but it's a global partnership that really focuses on women, children, and adolescent health and nutrition, and focuses on the countries with the highest burdens of maternal, newborn, and child mortality. And it's really an accelerator for scaling access to primary health care and universal health coverage ultimately, because of course we know that the spectrum, the continuum of care services across reproductive, maternal, newborn, child, adolescent health and nutrition really are the backbone of a strong primary health care system and on that pathway to UHC. So how does the GFF do that? It strengthens those programs by providing, really at the core of it is providing grant co-financing and technical support for World Bank financed projects, but also very importantly through this partnership, which is very inclusive across, of course, first and foremost partner countries, but also donors, civil society, private sector, philanthropy, et cetera, to really bring all of this, and UN agencies and Global Fund, Gavi, all of the big global health partners, to bring them together around to align support around country-led plans. And I'll go into that more in a little bit. And again, those countries where those have the highest burdens of maternal, newborn, and child mortality, and many of those, of course, we know are in fragile and conflict states. So the GFF is an important vehicle to expand access to medical oxygen and pulse oximetry, because at the core, that's a really core part of our effort to strengthen PHC systems and scale delivery of quality, affordable services. And we also ladder up to a larger World Bank target that's been set, which I'm sure Mickey will talk a little bit more to, by 2030 to deliver affordable quality care to 1.5 billion people by 2030. So over the past decade, the GFF has really made a significant difference in expanding access to health and nutrition for women, children, and adolescents since its launch. It's turned 2.5 billion so far in grants, and actually that number is rising, leveraging over 11 billion in World Bank Group financing and additional financing from domestic resources and external partners. Every $1, it's a really key part of the GFF is its catalytic role in leveraging more money. So every $1 of donor funding through the GFF is linked to $7 on average from the World Bank Group. And you've seen that in the data over the years that actually countries that have come under the GFF partner countries have increased their allocations through World Bank IDA financing, which of course is the World Bank's Fund for the Poorest Countries, highly concessional financing by an average 24%, whereas countries that are eligible for GFF funding but have not yet been partners with the GFF have actually decreased their commitments over that same period, so roughly a 50-point difference. So, and with that support, we've seen a dramatic shift of partner countries who, before they came into the GFF partnership, were lagging behind the global average on maternal and child mortality, and now have become global leaders. So we're very proud of that. And this is just a quick snapshot of over the past 10 years, hundreds of millions of women, children, and adolescents who have received life-saving care. So just in a nutshell, and it's hard to do the GFF model in a nutshell, but trying to break it down, there's sort of we've broken it down into sort of 4 steps, and the path brief that has been shared, I think, does a good job of summarizing this. But first and foremost, it's about working with We work with governments and with partners to analyze the leading health burdens and health system and financing constraints in a country related to reproductive, maternal, newborn, and child health and nutrition, and then work with the government to demonstrate that commitment to prioritize investments in that area, including how they might use both their own domestic financing as well as World Bank financing. So then working with governments to convene a multi-stakeholder country platform that's very much government-led, but we sort of help ensure that happens, and to work towards developing a country-led prioritized costed investment case for scaling up of those services focused on the highest impact interventions. And then having done that, and that's often very much aligned with existing health plans, et cetera, but really with that laser focus on women, children, and adolescent health. And then working with partners to bring everyone around the table together. So again, very much in line with the Lusaka agenda, one plan, one budget. That was the GFF remit from the start, but I think that's come into clear focus now as amid the larger conversations happening about how we optimize and the global health architecture. But that is really at the GFF core, bringing partners together, helping countries align partners around their plans, and align financing, whether that's from domestic sources, external sources, and or from philanthropy in the private sector. And we really work to bolster country leadership and ownership, but also to reduce health sector fragmentation so that countries are really optimizing the budget resources at their disposal and bringing as many of those resources on budget as possible. And then finally, committing co-financing grants to World Bank investments, whether that's through traditional investment lending, what we call P4R, performance for results, development policy operations. Mickey can talk a little bit more to this, but using various World Bank financing tools to drive results linked to improved outcomes for women, children, and adolescent health, and also to promote cross-country learning so that countries learn what's working and what's not from other, and can find ways to replicate and scale those solutions in their own countries. This is just a quick snapshot at our 2030 strategy, which we just started implementing this year. Many of you contributed to consultations on that last year. We had consultations globally, but also in most of our partner countries, and many thanks to all who fed in their inputs to that, which really made this a strong strategy with strong country ownership. Again, staying true to our vision of ending preventable deaths for women, children, and adolescents, but laser focused on how we scale up access to quality, affordable care, and also help countries transform their health systems and sustain those investments over the time. So I won't go through all of this, but it's really about how they are smarter, mobilizing more financing and smarter financing, accelerating progress. Key framing for the strategy is that while there has been significant progress over the last decade, too many countries are still lagging. And particularly, we know how the pandemic has set that progress in many countries. So how do we actually accelerate and scale progress? And then fostering that health system sustainability, sovereignty, and resilience. And there's 56 countries that are eligible for the GFF. We currently are we up until now, there's been 36 countries that have benefited from the GFF. I'm sorry, can somebody turn off their voice, please? And
please mute, please. I can't mute you for some reason. Please mute. Is that
sorry, Mr. Pactine, if you can mute your sound. Thank you.
Thank you very much.
But in the context for this strategy, we did refresh a view of which countries really are the highest burden countries. And we landed, some countries have improved significantly enough to actually, if you will, graduate from GFF financing. And we've also taken a view towards calibrating, classifying countries according to their burden. So you'll see the link there, but there's 56 countries. And our hope is that by the 2030, we'll reach GFF support, extend GFF support to at least 50 of them or more with a fully financed strategy. So finally, there's a whole range of opportunities for how we can prioritize medical oxygen and pulse oximetry in GFF eligible countries through the GFF platform. And I've listed some of them here. And obviously these are things that we want to do in partnership with this community, but it is about getting the evidence to the right people and using our country, working through our country teams with GFF and World Bank to do that, both to ministries, but also shared across countries. We have GFF government focal points in the ministries, but we also have our GFF country coordinators and a country team structure for the GFF. So they are key interlocutors participating in those country multi-stakeholder platforms. And if you're in a country and you don't know how to do that, the GCC can be your entry point to that, or we can help you navigate that. Those are opportunities then to influence the priorities that appear in the country investment cases and costing those intervention, including oxygen and pulse oximetry, making sure they're part of costed packages and health system investments. We also, I think one shift for people who know the GFF, it's not just about a once every 5 years plan, but we've really shifted towards a model of what we call a living investment case, where working with the rhythm of government's budget annually, donors' budget annually, right? And so wanting to make sure that these investment cases are not stagnant, but actually are prioritized on an ongoing basis, bringing in the latest data of where the needs are. And so engaging in that process of national annual prioritization and budgeting, and then linking very clear measurable results indicators and what we would call disbursement indicators linked to scaling oxygen access. Finally, I think it's always about advocacy, and Leith, you've been leading the charge on this for so long with this community, but we have to continue to advocate at all levels of government, but also globally for this, and through our GFF Civil Society Consultative Group, but also we're moving forward on a partnership, including with PATH, to have consortiums that will be providing on small grants to local CSOs, including to do advocacy for domestic resource mobilization, which again is an opportunity to link that to the oxygen agenda. So I'll stop there, but thank you so much for this opportunity and look forward to the discussion. Over.
Brilliant, brilliant. Thank you, Carolyn. So we've heard from Global Fund and GFF, two of the major global health agencies. You're hearing directly from leaders within those organizations, the ways in which oxygen can be in scope. So we know we're sharing a lot of information, but just stay tuned for the end, because PATH has found a way to make this very, very easy for you to navigate, and they're going to be launching some new documents that take you through it. So perfect timing from Dr. Mickey Chopra. He's lead health specialist in the health and nutrition and population global practice at the World Bank. Prior to that, he was at UNICEF. He understands the oxygen issues so well for such a long time. We're so happy that he's at the World Bank. He's just rushed from an Ebola meeting, so thank you, Mickey, for being here. He's going to tell us a little bit about all the ways the World Bank can help countries, governments, finance their national medical oxygen systems, should the governments elect to do that, and we hope they do. He's speaking for the World Bank, but a lot of what he says is relevant for multilateral development banks more broadly, and we'll come to that at the end of the conversation. But for now, it's the World Bank, and over to you, Mickey.
Thanks, Leith, and thanks for your leadership in this space, and for all the colleagues and everybody online. Really, as you said, we're just coming out of multiple meetings around what's going on in East Africa, and once again just re-emphasizes the life-saving and absolutely essential role that health systems and public health systems in particular, and within that, of course, infrastructure and oxygen is an essential component. Caroline, I'm sure, gave you, I hope, a sort of broad overview. In many ways, the same messages are going to come from myself. Is that as a development bank, it is very much country led, and so first and foremost is making the case to ministries of health and ministries of finance and civil society to be in the lead to do that. Because if they put it on the table, that's something that we are very receptive towards. But it is a challenge because of the competing priorities, and the sense that other essential infrastructure is needed as well. So I think this kind of partnership and working together and making the case, but also having models that are scalable, affordable, and feasible in the countries and the situations that need it the most is also completely essential. So our task team leaders are not only having to work with ministries and governments to prioritize, but also within that, what is feasible and deliverable within relatively short periods of time. That's also essential information and data that's required for them to then be able to incorporate it into the next lending and project and program partnership with the government. The primer that has been produced gives you a very good insight into some of the processes and steps. So I don't want to. I'd much rather take questions and respond to queries that folks may have. Leith. So just to emphasize again that the bank. The other thing that we're now moving much more aggressively towards is working with the private sector, including oxygen providers as well. And so there are some really good examples of that sort of partnership working and being scaled, both during COVID and post-COVID as well. So the other comparative advantage that the World Bank brings is that we have the private sector arm, financing arm, and instruments that so it's not just public financing, it's also private capital, and learning better how to work with public-private partnerships around oxygen is another important learnings that's going on as well, and potential for that to have more impact is there as well. So Leith, I'll stop there, but I'll be available for questions and respond to those as well.
That's great, Mickey. So I'm glad you can stay on because I'm sure we've already got quite a few questions in the chat and we'll have more. No question is too stupid to ask. These are very complicated processes. These global health agencies and their application processes can be tricky. So we want you to ask as many questions as you have, so we can pick them up when we get to Q&A. So we've got just a couple more funding sources. We've heard from three: Global Fund, GFF, and World Bank. The Pandemic Fund, I'm just going to come on camera again. The Pandemic Fund could not be with us today, but they are part of the funding agencies on the list. And I'm going to just voice over a little bit about the Pandemic Fund, just give you a taste of it, because they have an active call open now, which is really important. So the fourth call for proposals from the Pandemic Fund opened on April 1st. They have $244 million, it's a considerable amount, for 15 countries. So they've selected this time, this is different this time, they've selected 15 fragile and conflict-affected countries to target those millions to. I'm going to read the list out, but don't feel you have to write it down because we're going to that's all shared in the documents path we'll launch later today. Afghanistan, I know we have a very important biomedical engineer on the call today from Afghanistan who's been trying for a very long time to get a lot of PSA plants fixed. So Afghanistan is in scope for the Pandemic Fund. Benin, Central African Republic, Congo, Eritrea, Guinea, Haiti, Liberia, Madagascar, Radi. We have another enterprising biomedical engineer on the phone who's always trying to find ways to strengthen oxygen in Madagascar. So Radi, Pandemic Fund. Mali, Mozambique, Niger, Nigeria. We have a lot of Nigerians on the call at the moment. Sudan, Uganda. We have Engineer Tadeo on the call from Uganda, who has some brilliant ideas about how to strengthen Uganda's system. So these 15 countries are in scope for the pandemic fund. Once again, there are 3 pillars. So the applications have to hit one or more of these 3 pillars: disease surveillance and early warning, laboratory systems, or health workforce. The first question is, well, how do we fit oxygen into that category? You can. In fact, we did an earlier application to the pandemic fund, and Uganda led this. Engineer Tadeo and his team led this, which brought oxygen in through the health workforce by strengthening the technicians that are needed to keep all the oxygen equipment functional during a pandemic. That was ultimately not successful, but it got very close. So I think the onus is now on health ministries to go back to the pandemic fund with other proposals. That particular one was a multi-country proposal. We had Uganda, Malawi, and Nigeria join forces. One of the key things we learned from that process is that the ministries of health can't do it alone. They need what's called an official implementing partner. There's a list of about 13 of those, and the ministries have to partner with them, and they put the application in sort of together. So in this case, in this example, Uganda selected UNICEF. That went very well. Malawi selected the World Bank. That went very well. But we hit some roadblocks in Nigeria with the Nigeria Ministry of Health and Global Fund partnership. So we didn't put enough work in, I think, with implementing partners and ministries to ease that process. So advice for anyone considering the pandemic fund, please, please make sure the ministry is working closely and selecting a really good local implementing partner. The interesting submission process here is it's rolling submissions this time. So you can start work on an application now if you're in one of those 15 countries, and you can take as long as you like, as long as you get it in before the 31st of March next year. So you have plenty of time to put together a very, very strong proposal. The pandemic fund like to see co-financing, as all the agencies do now. So the governments will have to be putting some money on the table in these proposals, which is appropriate. The pandemic fund also likes to see other kinds of co-financing. So you could do a Ministry of Health, a multilateral development bank, like a World Bank, and then you go to the pandemic fund. And of course, they like to see full alignment with national health policies. Well, many countries now have national oxygen roadmaps. Uganda certainly does, Nigeria certainly does, Ethiopia does, and many others. So to align the pandemic fund application with your national oxygen roadmap is going to be key. So I'm going to stop there. You're going to get a lot more information on how to work with the pandemic fund when we hear from Carrie from PATH later in the call. But just to say, this is an active opportunity now. So if you're in one of those 15 countries, and you can find them online, they're easily found, please start thinking about applying to strengthen the national medical oxygen system. And I'm particularly calling on Afghanistan, Madagascar, and Uganda and Nigeria, because they're all on the call here and they've all been reaching out in the last 6 months saying, where do we get the funding to help us solve these oxygen problems? So thanks for that little interlude. Now we're going to keep moving and we're shifting gears. It's not just about big global health funders. There's these new kids on the block that are showing an increasing appetite to invest in local oxygen companies. There's a big debate in Africa at the moment about health sovereignty and controlling essential medicines, including oxygen. So we're so happy to have Viraj Shah join us. He's with a group called Transform Health Fund, which is managed by Africa Invest. They made a beautiful investment in a group we all know and love if we're in oxygen called Huatele. I think Dr. Bernard Alayo might be with us, the founder and really a driving force in local oxygen production on the continent. And we want Viraj to come and tell us why this private investment fund has selected this really pivotal oxygen investment, and will there be more? So Viraj, over to you.
Thank you, Leith. Hi, everyone. I can just share my screen as well. Maybe if I can request
Yes,
Caroline.
Carolyn, you might need to stop sharing your screen, Carolyn, so we can open it up for Viraj. Carolyn, if you could stop sharing your screen. Yeah, great. Thank you.
Thank you. Brilliant. So firstly, thank you to the organizers, in particular, Every Breath Counts and Path for hosting this webinar. And thank you to everyone to join. And we've had some fantastic insights on oxygen and solutions that are being put forward together to help increase financing in this space. So my name is Verge, and as mentioned before, I work with African Best, and in particular, I work for a healthcare focused fund called Transform Health Fund. I'm based in Nairobi, and obviously, as we go further down the line, I will be sort of speaking further to our investment that was led by myself and my team into Hewatele in 2025. A bit of sort of background and what we've sort of got out of our work and sort of the investment we did in Hewatele was that the medical oxygen gap in Africa and in particular in Kenya has been widening for a long time, and it's taken a lot of work and there is a lot of investment that has gone through it, but there is still the requirement for medical oxygen, and the gap has relatively increased over this time. Commercial investors and from a standpoint of African Invest, there is challenges because there's a lot of high capital intensive investment, and then at times the returns may not be as required from a perspective of a private equity player. What we did and what Transform Health Fund worked together with other investors was putting together a blended finance opportunity, and that was one that we felt was an ideal structure, and as we go further, I'll be able to explain more on that. So maybe just a bit of history on African Invest. Firstly, it's leading private Pan-African investment platform. It was formed in 1994, so it's got over 30 years of investment experience, and we are headquartered in Tunisia, but a strong presence across the continent. We've raised in excess of $2.3 billion, total investments across the continent, in excess of 230 companies, across 38 countries. And like I said, we've got a strong Pan-African uh, presence with 11 offices, one of them being in Kenya, and where I'm actually sat and based. And one of the reasons why African Invest moved into a um, healthcare focused fund was that healthcare in this continent needs more than just equity. We provided a blended finance or a blended capital structure that can back businesses that may be too commercial for traditional investments, and maybe not the best fit of traditional investments. Transform Health Fund is a $110 million fund, blended finance vehicle, as I mentioned, and it was launched in 2023 as a joint venture with the Health Finance Coalition, which was a vehicle under the Malaria No More uh, initiative. We deploy senior debt or mezzanine structures, $3 to $10 million, with tenors of up to 7 years, again, focused on Pan-African region, but with key interest in fragile low and middle income countries across the continent. Our investment is largely through three strategic pillars, which is supply chain transformation, which sort of includes everything from local manufacturing, distribution, financing essential health products. And this is an example of where our investment in Hewatele sits. We've also got innovative care delivery, and digital innovation that includes tech and a lot of advancements in telemedicine. Um, before we go into Hewatele and our investment, I think maybe just a bit of the oxygen background in Africa in particular, and East Africa as well. Um, COVID-19 exposed a big challenge generally across the globally, but in hindsight in East Africa as well. Um, the crisis was hiding, and it was brought out significantly by COVID, and the system was very fragile, especially here in Kenya, and more so in other countries in East Africa. Maybe just a bit of history. Kenya had 70% of PSA plants that are at present right now are either non-operational or below very or producing low quality products. So the medical oxygen output does not meet the World Health Organization's requirement of 90% purity. So either it's poor quality or very inefficient to maintain. Similarly, in East Africa, and you can see here as well, 40% of public facilities across the region have either no consistent oxygen available or challenges in the supply chain of medical oxygen provision. So in hindsight, and sort of the key takeaway is that oxygen is not necessarily a niche supply problem. It is a system level constraint, and investment in maternal care, surgery and emergency responses rely heavily on key oxygen. And to add to it as well, oxygen is not optional. It touches, like I've mentioned previously, it touches every clinical service. It is important at every age group or every age. And this is one of the reasons why we saw oxygen as an area of investment and of highest impact and highest, having the most adequate leverage system and improving the service delivery of oxygen. Hewetele is simply put together as a Swahili word of plenty of air. We looked at this investment in 2025, but the company was founded in 2013 and initially grew as a sort of provider through PSA plants. But what we have done and what we looked at and worked together with the Hewetele team was making a transformative shift away from PSA plants to liquid oxygen manufacturing. And that's where a lot of investment was put into, and we are in the process of developing a new facility, which is almost ready for commissioning and installation as we speak. A bit more on our investment. We had invested $10.5 million. This was through a joint partnership with their existing investors. So some of the investors, I think, as Leith mentioned, Dr. Bernardo Layo is on the call, but financial investors included the Soros Economic Development Fund, FinFund, which is one of the leading DFIs, UBS, and Grand Challenges Canada. We have also mentioned here with MedAccess and Unitaid, but the key over here was working together as a blended finance structure and as a co-investment opportunity to partner with a list of investors that provided the right structure and capital investment for Hewetele to develop this massive industrial scale expansion. As a nutshell, the capital that was provided by THF was designed to complement and work together with the existing investors. Beyond capital and what we've worked over the last year with Hewetele is we've provided patient capital. We've given Hewetele and the sponsors of Hewetele the ability to grow and have this expansion plan without diluting or without having a risk of cash flow shortages. We also provide technical assistance. This is working together with our impact and sustainability teams. And we're looking at working with Hewetele and ensuring that one, also the liquid oxygen plant itself is to the best of standards to increase efficiency and also have as most impact as possible. We're also working with Hewetele. There's broader African Invest portfolio networks. We've worked with, as I mentioned, one of the partners previously, UBS Optimus Foundation is a limited partner in the healthcare fund. So we have a network of investors that we've worked together with, not to mention, MedAccess as well, which was one of the partners on in this transaction. And as I mentioned, we've all seen the challenges, and we've seen how difficult this sector has been. We had similar challenges when we were looking at investing into the opportunity. And as I mentioned, we've put in on Transform Health Funds was $10.5 million, but it was with a co-investment, and the overall funding and the overall capital requirement for the liquid oxygen plan was significantly higher than that. So there is a high upfront capital intensity requirement. They take a long time to be built. Construction takes almost a year as well. Um, there is the challenge of the market. We've seen globally, and maybe the reliance on certain payers have made it that cash flows within, or returns of cash flows have made it a challenge. So there is the challenge of cash flow circulation and the economy. And other sort of factors that include the power supply. It is a very intensive project. It requires a lot of electricity. And I know one of the questions I was previously asked was through the use of solar panels. So there is mitigations, and there is mitigants that we've put forward, and made the plant or the site at the level where it is as efficient as it can be. And some of the other challenges do include regulatory gaps. There's always challenges with development, and ensuring that, purity and the quality of the output is to the highest level. One thing I forgot to mention was that this plant is at 99% a purity level. So that's, again, much higher than the World Health Organization requirements and sort of standards. So I think that's also a key area that we looked at when we were investing into Hewlett. And yeah, and key sort of opportunities, and why we feel that a blended finance structure was a very important way forward. The use of catalytic capital, and partnerships, as I mentioned and already alluded to. We worked with Unitate and MedAccess on this transaction. But we also see, DFI involvements, and impact funds. So we're seeing a much more mature financial system. So there is the ability to co-invest and work together with with other partners. Obviously, with the East Africa Program of Energy Access, there is greater government initiatives, there's greater government focus, and not just governments, but also international donors that are coming in and increasing the awareness in the region, and increasing or leading to a shift in the key, and ensuring that there is supply, but also sustainable demand for oxygen in the market. And I think, this is one sort of area that we looked at, is how replicable is this model, and how is it able to move into other countries in the region, and how not just working with Hewlett, but how is it possible, whether that's in a different country in East Africa or Pan-African region. We're looking at making sure that this is a playbook that can be used and can be sort of replicated in other regions as well. To just, provide my closing reflections, I think, it is imperative, and we all know it, that oxygen is key. Oxygen is a key infrastructure. It's not just a commodity. There is a lot of, and this forum, for example, is key to showing where the benefits and where the urgency is required. Like I mentioned, I think for us and as a commercial investor, we realized that working together with other partners for such a heavy capital intensive project was key. So I think blended finance is an important tool, and it's not just the burden of investing into this sector, into oxygen, is not for a single capital pool. It's for a mix of resources, and that leads to a success story that we can see with Hewatelia today. Um, and there's no denying the impact of oxygen. There is multiple lives that can be saved um, through increased supply of oxygen in the region. That does bring me to the end of my presentation. So thank you again for giving me the opportunity, and happy to take the questions as we go forward.
Thanks so much, Viraj. People want these slides. Don't worry, people. We will be sharing all of these. They're excellent deck. Thank you. We'll be sharing all of these things with you, so don't worry about that. I can't resist the opportunity to invite Dr. Bernard Aleo to make a few comments. Bernard, if you're able to, I mean, how did you crack this level of private sector investment? I'm sure everyone's keen to know.
Thanks, Lee, for that. And I want to thank our partners, including everybody who's invested in the company. It's been a lot of work. I think we did this by showing but also the commitment. We've been producing oxygen in Kenya from 2013 and supplying very many hospitals. And I think what we did to the Kenyan people during the COVID-19 outbreak is what gave us the momentum to build this. But I think for anybody who wants to attract such kind of investment, there are a few things that I've learned through the way. One is ensuring that the company is set up and governed properly, and that the production that you're doing meets the international standards. That was the main entry point for all these investors. Before they could work with us, they wanted to make sure that we are doing a good job and meeting all the international standards. But yes, to get these 4 investors, we had to talk to maybe 17 of them. So it takes time to get them on board. And what worked for us is that we had to engage a transaction advisor that knew the lay of the land and could help us to walk through this journey with them. But I want to just thank everybody. We expect our plant started producing liquid oxygen this past week. It's undergoing commissioning right now. We hope to be in the market by the end of this month. And if anybody is in Nairobi, please get in touch. I can bring you to the plant to see how beautiful it is. Thank you very much.
How exciting. Bernard, please put your email in the chat. And thank you for being such a pathfinder and leader. I think it's over a decade you've been at this and you've never, ever given up. And look at the results now. So congratulations to you as well, personally.
Thank you so much. Thanks.
All right. Okay, so thank you to all of our speakers. We've heard from 4 global health funds and 1 private investment fund, and we've given you a lot of information. And now, drum roll, I'd love to invite Carrie Heminger from PATH to launch a series of documents that we think are going to make it very easy for you to take action in working with these sources of funding. So, Carrie, over to you.
Thank you, Leith. Good morning, afternoon, and evening, everybody. Just give me 1 second to share my screen. Okay. That is not the screen I shared. That's very strange. No, my apologies.
That's all right. It's always tricky with these different platforms. Thanks everyone for keeping to post things in the chat. We're going to come to Q&A after Carrie, and we'll be able to pick some of these up. So thank you for that. And thanks also to our speakers for answering some of these in the chat. I can see you've been very busy. That's great.
Now can everybody see that? Oh, no, not yet. Now try. No, this is very strange. Okay, here we go. Apologies.
All right.
Okay. Good morning, afternoon, evening, everyone. As Leith said, this is a series that we have put together, kind of building from tools Path has previously published. In 2023 and 2024, we put out an infographic first on the Global Fund and then on the Pandemic Fund on a similar topic on kind of looking at how to leverage these platforms for oxygen funding. We also, as part of our oxygen delivery toolkit, had developed an investment case user guide for GFF, which is what we used as a starting point for the GFF brief in this series. And so we really wanted to package these as a coherent set of resources that kind of align with each other, and just point to other resources that stakeholders can use to really leverage these financing mechanisms, particularly in this environment where other funding opportunities have become scarce. So we really have envisioned this brief series as a way to equip governments, development partners, civil society, and advocates with practical guidance to mobilize financing, shape policy around oxygen, and integrate it into their national health priorities. And each brief distills this information about these complex financing mechanisms into actionable steps, particularly to help countries secure sustainable investments across an oxygen system. So from production, delivery, data systems, and workforce capacity. You can see here the 4 briefs that we have in this series. And we also outline kind of what is highlighted in each one, who can benefit from this brief series, as well as pointing to other resources around oxygen financing. So in addition to the 2 infographics that I already mentioned, we also include here the Global Oxygen Alliance investment case, as well as some of the resources that came out of the oxygen financing side event that was held in 2024, because there's a lot of really great information in the recording from that event as well. I thought what I would do is take a bit of a deep dive into some of these to just kind of give you a snapshot of what each of them contain. So this is the Pandemic Fund 1. And as I noted, each of these kind of align along the same kind of sections. So it's really easy to navigate and know what to expect. Each one highlights who benefits from this brief and the information within it. It gives a little bit of a background about each funding mechanism, particularly when they were established, what their high-level priorities are, kind of how they give out grants or loans, and anywhere, as well as the most up-to-date information about how you can apply for such funding. So, for example, as Leith had mentioned, the Pandemic Fund just launched its 4th call for proposal for these 15 priority countries. Each brief gives a little bit of high-level tips on how to leverage the financing under this mechanism, which then it goes into more detail further into different parts of the brief. Each one talks about kind of high level where oxygen can fit into the mechanism and into the funding opportunities for this mechanism, whether that be an investment case, proposal, application, what have you, and just gives all the relevant information you need to know. And where necessary, it links to other resources or information to go more in depth. Each one also points to other resources that can be leveraged as part of proposal development and prioritization. Most notably, the Lancet Commission on Medical Oxygen Security, the Global Oxygen Alliance investment case, as well as the broader set of literature and resources that are accessible through the Access to Oxygen Resource Library. It then goes into a little bit more about where and how to engage in the process related to that funding mechanism. So as Leith mentioned, this really for the pandemic fund goes into engaging with an implementing partner, how that works, what the process is for preparing and submitting a proposal, and what to expect through the rest of the process towards approval. The next section really talks about practical tips on where and how to either engage with these entities, where and how to incorporate oxygen into priorities and into applications, and just broader things to consider throughout the process. So these are very helpful, and they're targeted to each funding mechanism. And then each one provides examples, in some cases specific country examples, and how and where different parts of the oxygen system can be incorporated into the proposals. For example, in the case for the pandemic fund, it's really a lot about where oxygen fits around pandemic preparedness, right? So it's about access to pulse oximetry, making sure oxygen is available as a treatment, making sure that oxygen can be monitored as part of response efforts, and so on. And then lastly, each one includes contact information. So we already heard from all of our speakers, some of these entities, like I believe in the global or the GFF one, it mentions some of those networks that you can be in touch with to kind of know where you can participate in the investment cases that countries make for maternal, child, and adolescent health. And it also each one includes a list of further resources related to that mechanism, so you can just get more details around the proposal process, any other guidance they've put out, strategic plans or priorities of that entity, and so on and so forth. Just any resources that are helpful for you to learn more. The Global Fund and the pandemic, or in the Global Financing Facility briefs, are very similar since it's focused on one entity. The Multilateral Development Bank follows a similar format, but it just goes a little bit more in depth into kind of some of the big players in this space, which includes the World Bank, Asian Development Bank, African Development Bank, and some other notable ones. So this is a little bit more generalized to how it can fit into any of these entities' proposals, but still very, very helpful. And with that, I think that's it. I'm happy to answer any questions, and we will be sure to include the link to these resources in the chat.
Thank you so much, Carrie. If you could drop the link, that'd be great. These are complicated processes, but these briefs are the best I've seen in terms of making it really simple, step by step, to get a handle on how you can begin to engage with these possible funding sources. So thank you so much, Carrie. Thank you so much, Path. So we've got some time now for question and answer. So I've been looking through the chat. Most of them have been answered, but there are some that are outstanding. I'm just going to pick a couple up, and then we've got time for more. So please be thinking about questions you'd like to ask of our speakers. Engineer Tadeo from Ugandan Ministry of Health raised a really important issue. Some of these applications, particularly to the global health groups, are quite complicated. They're usually online, and they're very detailed. And some ministries may feel they require technical assistance to even complete the application. So I'd like to ask some of our speakers, if maybe start with you, Nick, does the Global Fund or the local CCM provide any support to ministries in their Global Fund applications?
Thanks so much, Leith. I think you'd have to go. So we have a country coordinating mechanism, which includes all the partners and stakeholders at the country level that are involved in developing a Global Fund funding requests. Apologies, I have a hungry dog behind me, but most of the time you will find that the TA is provided through the country coordinating mechanism and through the partners who are involved in ensuring that the Global Fund grants are shaped accordingly. So though the Global Fund centrally doesn't provide TA funding, it will be available through the CCM and through the partners who are involved in the CCM. Thank you.
Thanks, Nick. Do any of the other partners, Mickey, Carolyn want to talk about any assistance that is locally provided to ministries?
Yeah, Leith, this is Mickey. Yes, absolutely. If we do have limited, and Caroline, if she's still online, can talk more about GFF, but the bank itself as well does have some limited technical assistance resources. So if the ministry was to make a request, for example, to help to do an assessment of oxygen needs or put together an investment case for scaling up of an oxygen system, that's something for sure they can be in touch with the local bank officer, health person, and discuss with them. We can
Mickey?
help to mobilize some resources along with partners.
Yeah, and just to add, this is Carolyn, just to add to that same, I mean, the GFF is also part of the bank country team, our country coordinator in country, and we have a country team structure with a country team lead and an in-country coordinator, but they're also part of the World Bank country team. So whether it comes through the bank or directly to the GFF country coordinator, if there's a specific request that the government has, then they can see what is possible in terms of mobilizing specific resources for that, technical support, potentially grant support for that.
Thanks very much. There's a couple of requests for the link, Carrie. I'm not sure if you've dropped the link into the chat yet for the briefs. Please do when you get a minute. Okay, now let's open it up. Any other questions about all of this information we've just shared? You don't need to raise your hand. You can just come off mute and speak.
Lisa, this is Jason. I'm wondering,
Great.
maybe this is a hi. Maybe this is a question for Carrie or others at Path. I was just wondering the tips for successful applications in the briefs. Are those based on specific examples of oxygen projects that have been funded in the last few years by these different facilities? And if so, are there like more detailed case studies to help governments and partners who are supporting governments with applications understand how those projects were framed and why they were successful versus others that maybe weren't?
I kind of a combination of both. Obviously, like us at Path and Leith also helped as well in kind of pulling the content together. So using what knowledge we had, where countries have leveraged these mechanisms, we tried to incorporate tips that we had heard of or that had been used. Other ones are just a little bit more aspirational, I guess, to a certain extent. There is I think both the GFF and the Multilateral Development Bank. No, actually, it's just the Multilateral Development Bank one. Those do have actual examples of where countries, the examples in there are DRC, Pakistan, and South Sudan, did leverage funding. It doesn't necessarily go into detail about like what they put in there, like what specifically they put in their proposal, but like just what they asked for and what they received back. And it also links to like where that information comes from, where you could learn a little bit more. There is a couple of examples in the as I mentioned, we have in our Oxygen Delivery Toolkit an investment case guide that focuses around investment cases related to GFF. And that does include a couple of more specific examples of where countries included oxygen, like much more specific. But we welcome other people coming forward with such examples where we can highlight them because that information is very helpful, but we could only go off of what knowledge we had at the moment. I hope that's helpful.
Thanks, Carrie. Yeah, heaps of examples of Global Fund, oxygen projects financed some from World Bank, some big ones from World Bank, mainly during COVID, very little from GFF, but that's because countries haven't been prioritizing this in their investment cases. And you heard from Bernard. I think Bernard Aleo and his journey to get unlocked private capital to the degree that he did is a story worth telling. And he would be he gave you a taste on this call, but he would be a great person to talk to get a sense of how he did that as a model. Immaculata.
Yeah, thank you, everyone. Thank you very much to the speakers. So I would like to know if medical oxygen has been included as part of interventions under One Health. I know that for this fourth call of round of pandemic fund, it's a strong consideration in Nigeria, for example. I don't know about other countries, but I want to know if that conversation has gone far, how far it has gone in other countries about medical oxygen being included as part of One Health, under One Health. So it can guide proposal writings and all of those engagements with the national governments in the various countries. Yeah.
Did you say, Immaculata, Nigeria is including oxygen as part of their One Health approach?
It hasn't been fully included, but it's a conversation that is ongoing. So I don't know if that same conversation is going on in other countries. I don't know.
I don't know either.
Strong consideration.
I don't know either. And that's a very interesting question. In the interest, we have a lot of countries on this call. If there is a conversation in your country about oxygen and One Health is all through the pandemic fund application. It's something they've embraced. So if you could just let Immaculata know, and that's something we should look at a little bit more too, Immaculata. So thanks for raising that. Note that down. Thank you. Any other questions or comments? So we have a lot of comments in the chat from Madagascar, which we know has a lot of oxygen challenges. Anything else anybody would like to ask? To Jason's point, one of the reasons we're doing this webinar is we need more examples from the countries, successful examples where ministries of health have led and worked with partners to unlock some of this funding, and also where local companies like Huatele have successfully unlocked private capital. So the purpose of these briefs is to give you the information and knowledge to really roll your sleeves up and get together with the Ministry of Health and work these channels. Dr. Awali from Huatele.
I have a question in the chat if you can have a look at it. Thank you.
Can you just voice it over? Now that you're here, why don't you just share it?
All right. I was wondering if there are any partners or investors or funders that have or will have in the near future a free gas program or a subsidized gas program for the country, targeting local manufacturers for supply of this essential medicine to the public sector facilities. Thank you.
In Kenya, you mean?
In Kenya, yes. Thank you.
You're looking for any funders who are preparing to fully subsidize free medical oxygen?
Fully subsidized, partially subsidized. We had a program like that through Global Fund that was channeled through AMREF a couple of years back during the peak of the pandemic. We're wondering if we have a similar program in the pipeline that would then support investments like ours that have been set up on a mix of debt and equity to improve the offtake, so that then we can then improve capacity utilization and reduce cost of production that then can be passed to the customers in terms of lower gas prices.
Yeah. Well, this will depend on the ministries of health and what they apply to these funds for. So yes, the Global Fund is still able to provide support, as you heard from Nick, but the Ministry of Health is in the driver's seat in terms of applying for specific funding. So you would be better placed asking your Ministry of Health whether they have any plans to apply to the Global Fund or some of these other agencies, and what they plan to fund to apply for.
Most definitely we do that. Thank you.
Okay, thank you. Gabrielle, and then Arnold.
All right. Thank you for this session. It's quite enlightening. I've noticed that most of the references for funding are directed at the Ministry of Health.
Yes.
So I want to are there other opportunities for maybe private holdings who are not directly ministries, but as creating something in the oxygen space? For example, maybe an organization want to tackle supply chain issue within the oxygen space. Are there fundings? And if there are, do you have to go through the ministry, or there's a way of going directly to those funders and or investors? Thank you.
Can you tell us a little bit about where you're from, Gabriel? Are you part of a company?
I'm from Nigeria. I'm in government. I work with the Kaduna State Ministry of Health, but there are some ideas around where I am where people are looking at solving supply chain issues.
Yes.
But not directly from the government, but outside of the government, small holdings, sort of.
Did you hear the Africa Invest presentation from Viraj Shah? That's a private fund in Africa that invests in oxygen companies. Did you hear that presentation?
No, I did not. Sorry.
Yeah, that's all right. So Africa Invest, when we share the recording, you should look at Africa Invest and Viraj Shah. You might want to put your email in the chat. So this is a fund, many millions of dollars, that has invested in Huatele, which is a Kenyan oxygen company. It's a wonderful investment, and he was presenting that, and he said that there may be other opportunities. So I'd encourage you to look at Africa Invest. They're not the only one. There are quite a few private funds in Africa that are investing in healthcare, and that's where I would turn if I were you to look for financing. We don't have a special brief on that. We focused on the 4 big global health agencies, but perhaps in the future we might do a brief on private sources of funding, because your point is well taken. A lot of the solutions here are about private companies and private industry stepping up. Arnold. Arnold Bett.
Good evening from where I am. I hope everyone is well. My name is Arnold Bett, working with AMREF South Africa under the Oxygen program. So I just had a question to the team and the speakers. Are we looking at availing funds for sustainability and reliability and self-reliance of the oxygen infrastructure that most of the ministries of health in different countries have been able to implement? Specifically, like the way we've been, AMREF has been at the forefront to implement the oxygen program in Kenya and assisting the larger East Africa region to try and get more oxygen accessible and affordable to patients in different regions. So one of the key challenges that we've really faced is getting that model being sustainable and self-reliance, and was looking at if there are chances and opportunities for financing on the same path. Two, one of the best ways to be able to achieve sustainability and self-reliance of the oxygen infrastructure is us being able to train, mentor, and capacity build on all the most.
Arnold, it's quite hard to hear you.
Oh, okay. Can you hear me now? Is it better?
It's a little better.
Awesome.
We've got a few minutes left. Can you just sharpen the question so we can get an answer for you?
Oh, so it was just matter sustainable and self-reliance on the oxygen infrastructure, as well as maintenance and sustainability of the plants. Thanks.
Yeah, you've raised a huge issue, which is how do we finance? Who finances? How do we finance ongoing maintenance of oxygen equipment? There's a couple of comments in the chat about this. This nut has not been cracked yet. It's a big challenge. It's front and center of a lot of the groups that are part of the Global Oxygen Alliance. Ministries of Health need to consider it. I know the Global Fund is very conscious of it. So it's very hard to find a financing model that can fund the small companies that are needed to perform this function. I don't know we have solutions yet, but just be confident that it is definitely a priority for those people working in medical oxygen. There's another interesting question in the chat. I just want to get it in because it's quite intriguing. Would the GFF or the World Bank ever partner directly with a national health insurance authority? I guess that means to subsidize or fully cover the cost of oxygen for those who are insured. We know a lot of people are paying massive out-of-pocket costs because governments don't cover it for oxygen. So I don't know if there's ever a way the World Bank would consider such a proposal, but it's a very interesting question.
Sure. That's often not the way in which insurance would normally cover up, the whole event, as it were, as opposed to specific pieces of a diagnostic or an event. But we do work with many countries on supporting their insurance fund, their national insurance funds often. And making sure that these things don't fall between the cracks, as it were. So if there is this sort of challenge going on, a gap, please do bring it to our attention, and would be happy to work with the relevant authorities to see if there's a way in which we can help.
Okay, that's great, Mickey. Let's just summarize. So you can hear from our speakers, this is really about local actors, the Ministry of Health and its partners, putting together really investment-worthy proposals that are so well aligned with the requirements and national plans and policies, like such strong proposals, but the onus is on the country people, and there's many on this call. We know many of you have Ministry of Health relationships, you work in ministries of health. It's really about getting deep inside the Ministry of Health. We all know how ministries of health work. There's power structures within them. There's people who make the decisions. Get right in the center of those groups to craft oxygen proposals that align with these international agencies, and then use their structures and their application procedures to try and seek that funding. It's a lot of work, but there's potentially big payoff. This is large amounts of money we're talking about that are available, and too often they're left on the table because our oxygen people, frankly, at country level and global, are just not in the room when these decisions are happening. So we've tried to craft a set of briefs, thank you to PATH, that get you in the room where these decisions are made. So please, we encourage you to view them, to read them, to share them, and to use them. And don't hesitate to reach back out to us, to my group at Every Breath Counts, or to PATH, if you want to move forward with any of these proposals, because we can certainly provide advice, and we have a Global Oxygen Alliance now, or goal, with a lot of these key actors on it, who can potentially provide some support. I want to thank our speakers and all of us for staying, those who stayed for the 90 minutes. This is our final in the 5th series of webinars on oxygen. It's our most important because at the end of the day, nothing really happens without robust financing. So here's some opportunities. Don't let people say there's nothing available. There is funding available. We just have to be smart enough and have proposals that are strong enough to secure this support. So we want to leave you on a very positive note. Go out there, read the briefs, and get into these proposals. And let's come back in 6 or 8 months' time and have some success stories to share. Thanks so much, everyone, and we'll share the recording later today. Thank you.
Thank you so much, Liz.
Thanks, Tadeo. Don't worry, we will get these regional centers of biomedical engineering excellence. They will happen.
Thank you very much for the meeting.
Thank you.
Thanks a lot, everyone.
Thank you.
Thanks for all these great comments in the chat as well. Thanks so much.